at 8:45. What if there was a way to assess an athlete's risk for injury and stop it before it even happens? That sounds good to a lot of people. Well, Sparta Science is a Valley-based company that applies data and technology to identify and reduce injury risk. And the technology was previously available only to elite athletes, and it's come to Charlotte at Novant Health's Exos facilities.
And physical therapist and program manager Eric Ford is here to give us the 411. And as part of the technology, there's actually a scan. So what does the scan do and who is it for?
So the scan is really for anybody that wants to stay active, whether it's a youth athlete to a high school athlete, collegiate athlete, or even those that just want to stay active. It's a scan that we can do very quickly and very simply in order to identify the risk for injuries. And so what Sparta Science has done is they've developed a way that we can predict, prevent, and rehab a patient based on objective data.
And so that means it is for a specific person. You're not giving out the same answer to every single person.
That's correct. So what we can look at is with a vertical jump, we can look at 3 different aspects of their jump to help identify different parts of the body that can be at risk for injury.
So let's talk about the next steps for those who scans identify. Maybe they do have a risk for a certain kind of injury.
So once we can identify a risk for injury, we then work with our Exos sports and performance coaches, which we can then prescribe certain exercises at our facility, and we can help lead them and guide them into that transition to sports and performance.
And what would be the benefit of being able to identify a risk early, and maybe some precautions that those people can take if there are risks that you guys have identified?
Yeah, so if we can identify those risks early, and especially with like youth and high school sports nowadays, everybody specializes. And so what this test does is that we look at those weaknesses to help kind of prevent that injury early on in their youth sports to help prevent injury as they get along into high school and into the college age.
We moved the table away, and you were doing a little demonstration on what some athletes might be doing when they come into your facility to test these risks.
Correct. So what I'm going to take you through is just a quick little vertical jump test. We have very limited space, so we're going to give it a go.
We'll stay out the way.
We'll clear out of the way.
So one of the things that we do is we do a little vertical jump. So what we look at is the amount that the client can load down, and that's going to look at their eccentric strength and can they build tension. So once they get down into that squat. So if they have any sort of issue getting down, that can kind of lead to an ACL injury, a foot ankle injury. It could be also a lack of mobility at the ankle. Once they're able to get down, we then look, can they stabilize their core? And so what you're doing is you're kind of, pushing down into the ground to prepare yourself for blast off. And then once you're down here, you kind of get that jump and that land, and we look to see if there's any sort of a glute weakness or are your calves tight, and it can kind of allow us to prescribe different exercises based on that.
And for people who have an injury or maybe can't jump, there are other ways to use the scan, correct, that don't involve an actual launch like you described?
Correct. So, one of the things that we have done is, on the rehab side, is we've had post-surgical patients where we'll have them come in and we'll measure their balance. Can they stabilize that leg? So if they've had like an ACL tear, they come in, they balance, and we can track that progress over the course of like 3 to 6 months.
Wow, it's all about personalization, and I love that you do follow-up so you can see the progress that someone makes with actual data.
That's correct. So, we are the only hospital-based system in the state of North Carolina that currently offers this. And previously, it was only with professional sports teams and collegiate teams prior to us getting this technology.
Wow.